Hi, this is Dr. George Mirsal. I am a DDS, BDS, and MHA with a couple of fellowships. I have been practicing this beautiful profession for like 2 decades right now, almost 20 years in 2 countries. And I have been an owner of Cleopatra Dental for 4 years so far, and hopefully for life. And I would hope to see you here. Dentistry in general is like one of my greatest passions in life. Maybe very close second to my family, which I hate to say it, but it is what it is. Dentistry is about art, about connecting with people, about making them smile and happy, about changing their idea about the old dentistry, about being afraid from going to the dentist and dealing with a lot of drama and costing them a lot of money. It can be much more simpler now. It can be much more feasible and attainable and and predictable with our care. What I really love most about our practices is our philosophy of dealing with people like our own family. We don't try to add treatments or even um, make them do our philosophy or what we think. We let them think for themselves. We let them have the options. We give them all the knowledge we know. We offer them all the modules and targets and goals, and they choose what suits them better. That's their body, that's their choice. Well, the most noticeable fact, I have been working in 2 countries, and I have seen dentistry in more than 3 or 4 states in the United States. The very obvious thing that comes to my mind is that we are all human beings. All the teeth are very similar, but in the same time, we are very unique in what we want and what we need. We are very unique in how we approach our fears, our expectations, and as my wife said, the smile is one of the very few universal languages. You can smile anywhere in the world. You can be in the middle of Paris or Italy or Egypt or here in Los Angeles or Orange County, and then you smile and the person in front of you will smile back at you. That's the only universal, acceptable, beautiful language that everyone knows. Education matters. Education really matters. We, being graduated from 2 DDS degrees and having spent at least uh, maybe 10 years of my life or more in learning dentistry in a lot of institutions, is very impactful. We always think that when we go to the dentist, we want like great skills or great hands or great results. But in reality, nothing guides the results and nothing guides the art without science. The science and the reasoning behind any touch or any procedure is what makes it really good. Some small details, some small line angles, some small facts are make all the difference in the shape and the shade and the color of the teeth. And the net results always affected by science and academic facts. We never underestimate uh, the power of knowledge and experience in our practices. We really always hope to keep learning and keep getting better at what we do. Being in love with painting and doing some arts and actually a little bit of sculpturing was actually the main reason I went into dentistry. And I wanted something to work with my hands. And using that in both, whether it's like painting and art or dentistry, is really almost very similar. Very, they actually complement each other. Using the brush to make a strike can make all the difference. With the wrong color or the wrong shade or the wrong strike can change the whole picture. You can make a horse, you can make a donkey by just one line. But when you are doing teeth, you have to pay attention to the line angles, the how sharp or rounded your lines are. You can make one person with needs to show a smile that shows dominance or shows professionalism. That's different from someone who wants to look cute or younger, or all of this is controlled by small changes in line angles, for example. um, every small characteristics or details can make much bigger difference than what you can imagine. And that's the biggest connection. Dentistry is literally a science and art. It's not just a science, it's not just art. It's a connection between both worlds. We're lucky we are in a technology and age where we can replace teeth with something like implants. Implants are the closest thing to a tooth. A tooth is basically a root and a crown, and that's what implants are. And instead of the alternatives, which is like a bridge, you have to cut two good teeth to carry one lost tooth. So definitely implants are the best solutions right now with 96% success rate over 10 years. There's nothing better, really. Implants should, yes, stay forever unless something big happens. And yes, all the research, all the data are really saying that implants have a success rate over 96% for over 10 years. So yes, they can live forever. Yes. Choosing between multiple options like implants and bridges and partials and etc. is is not a decision you can that have one size that fits all. You have to consult with us or with any professional to know what's exactly that can be good for you. Usually, if you don't have a big medical problems or some huge issues, most of the time people can get implants. Yes, no problem. But you can't decide that on your own. You have to ask a professional because there is a lot of details that entails to which treatment plan is better for you. Implant is a very, again, gourmet procedure. Like, it's a very surgical and accurate procedure. It's not destructive. Like, for example, extraction, you are tearing and removing tissues. But in case of implant, you are very oriented, you are very precise. Everything is very clean and sharp cut. So it's really not painful at all. I have seen during my life, I have seen much more complications to extractions or surgeries than implants. I have rarely seen any problem with dental implants. Very rare, very few, and it's. I just let the patients know my own experience. I show them results. I show them cases, and they understand. They actually always get impressed with how easy it was and how fast it was. One of the funny stories I have seen, and it was impressive even for me, and I have been doing this for a lot of time, is that one patient specifically came to me thinking that he was down in his life. He was so sad, like he had a situation where he went through family problems and some health issues. And he came to me and he was like, "Hey doc, I wanna sit up on my feet. I wanna stand up. I wanna start a new life and a new job, and I really need to be confident about my teeth." With very few steps and procedures, like some single crowns, some single implants, and some cleanings, he actually stood up on his feet. I saw him next time. He gained some weight. He got the new job, and it was impressive. I'm not promising that when you get implants at my office, you will get a new job. I'm just saying this happened, and it was impressive.